Now, like a lot of you, I was a little depressed on Tuesday.
Well, yeah.
That was not one of our better days. But by Wednesday night, I was no longer depressed. I was angry. Because the fact is, nothing really has changed by that election. On Monday, 120 people died in this country because they did not have health insurance. On Wednesday, was it any different?
No!
Do we still need health care reform?
Yes!
On Monday, 14,000 people in this country lost their health insurance. Was it any different on Wednesday?
No!
Do we still need health care reform?
Yes!
On Monday, people were going bankrupt in this country at a rate of 350,000 people a year because of health care costs, because they can't afford to pay for the health care they desperately need. On Wednesday, was it any different?
No!
Do we still need health care reform?
Yes!
When do we need it?
Now!
You said it.
Oh, yeah.
We have a chance, and we were moving close to passing health care reform legislation that is comprehensive on Monday. It's not everything we want, but it's legislation that would stop health insurance companies from denying people care and coverage if they have pre-existing medical conditions. You wanted that Monday. Do you still want it?
Yes!
We were close to getting health insurance reform that would provide subsidies so everyone can afford health insurance in this country. You don't even know how good those subsidies they were. I'm going to tell you. For families of three making $27,000 a year, they would pay $68 a month under this legislation. Is that pretty good?
Yes!
Did we need it Monday?
Yes!
Do we still need it?
Yes!
There are provisions in that legislation that will create a national health insurance exchange so that individuals and small businesses can come together and get health insurance at the same rates that big businesses get. Did we need that Monday?
Yes!
Do we still need it?
Yes!
Has anything changed?
No!
When do we need health care reform?
Now! Now.
Nothing really has changed. Healthcare reform is as important now as was on Monday. That election doesn't make a difference. There are plenty of ways to get this legislation through Congress. What we were thinking about before may not work, but the easiest thing is to pass a bill that fixes the Senate legislation, to have that legislation have everything we want in it, and then pass the Senate legislation, and you can do it in that order, and then get it to President Obama's desk. That will give us 95% of what we would have gotten on Monday. We need it on Monday. Do we still need it?
Yes!
What do we want?
Health care!
When do we want it?
Now!
What do we want?
Health care!
When do we want it?
Now!
What do we want?
Health care!
When do we want it?
Now!
Now.
We've got to move this legislation because, like you, I'm angry that in the aftermath of Tuesday, our political leaders in Washington seem to be dithering. They don't know what to do. They're throwing their hands up. They're looking at each other and saying, what next? We have got to tell them what next. The next thing they need to do is pass healthcare legislation, healthcare reform legislation, and they need to do it immediately. We have been waiting and waiting. This campaign has gone on for 18 months. It is long enough. It is time for them to get their act together in Washington. It's time for them to figure out the way to move forward. Their job is to figure out the way. There are lots of ways to do it. Our job is to make them do it. Are you ready to do that?
Yeah!
Well, that's why we're here today. We're here to show our members of Congress that we have got to move health care reform forward. Now, we have a couple people who are going to speak.
My name is Gonzalez. I am a physician, and I am here today on behalf of the National Physicians Alliance and Healthcare for America Now. The National Physicians Alliance is an organization organization that's committed to improving health and well-being, and also to ensuring equitable, affordable, high-quality healthcare for all people. HCAN and NPA had worked together with many other organizations to support the healthcare reform. It has been a difficult road this year with many exciting moments but also many setbacks. We remain dedicated to the passage of the healthcare reform legislation, just like we do with our daily practices when we find difficult diagnoses, difficult treatments, and difficult prescriptions. We do not abandon our patients when they need us, and we do not abandon healthcare reform because of the recent elections in Massachusetts. Nothing has changed in our healthcare system. The U.S. is still number 37 in the world in healthcare. We still have 50 million people uninsured. Insurance companies still can deny coverage based on pre-existing conditions. They still can delay or deny needed care to patients. The cost of health insurance keeps going up, making it unaffordable for more and more people every day, even when insurance companies' profits continue to skyrocket. Abandoning the healthcare reform now is morally and economically wrong.
Yes.
As you all know, there are two bills now, one approved by the House and one approved by the Senate. Since the election in Massachusetts, there have been many prescriptions to fix the bill. One is to abandon the bill completely. Anybody here in favor of that?
No!
We are not either. We cannot afford to continue the status quo. Another prescription is to pass only the parts of the bill that are non-contentious. This will not solve any problems. It will be like asking a surgeon to remove only part of the tumor and let it rest heal by itself. For example, if the Congress requires insurance companies to cover all pre-existing conditions but do not require everyone to purchase insurance, then many people will decide to buy health insurance only when they get sick. Just like when you get car insurance, you only may want to get it after you get in an accident and have the insurance pay for the damage. This will not work. The insurance premiums will go up even higher, the insurance systems will fail. But if there is a mandate to buy higher insurance, then there should be provisions for anybody who needs to buy it so they can afford it. The third so-called prescription is to have the House pass the... It is very easy to get distracted with the news of the moment, like the Massachusetts elections, and also by the noise of the voices opposed to healthcare reform. It is also easy to lose sight of what is important and what is true and remarkable about the bills. Healthcare reform is very hard. We continue to advocate for our patients on this critical moment. Just as doctors must find courage when prescribing a difficult treatment to cure a disease, President Obama and Congress must not abandon the American people who elected them to solve this problem.
Yes!
We urge President Obama and Congress to pass the Senate bill now and work